Well, good afternoon and welcome to the third floor conference room of Waco City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco. And today we're having another one of our informative press conferences to hopefully inform you and have the opportunity to get answers from our specialists about this COVID-19 that's going on. What we're doing in our studio downstairs, we have an American Sign Language interpreter providing a sign language interpretation for anybody that needs that. And we're also recording a full Spanish audio portion of this to be replayed and laid on top of the audio that we will replay this afternoon at 4:30. So our Spanish-speaking audience can also learn all the information that's shared today. And always so gracious to be a part of this is our City Council representative for District 2, Hector Sabito, who will invite our Spanish speakers and tell them about our 4:30 broadcast this afternoon. Hector, thank you for being with us.
Larry, as always, it's an honor, and thank you so much for the invitation. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, una traducción en español en vivo está grabando durante esta conferencia de prensa. Esa grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, as always, thank you again.
Thank you so much and appreciate it greatly. Well, as I've said before, we're doing this all virtually, and in our third floor conference room, there's actually 4 of us here, but we're all wearing masks. We have Julia Olvera from the City Secretary's office. We have Kelly Crane from the Montgomery County Health District. And we have Mark Randolph with our television station who's doing the electronic switching, and I'm here to be the moderator for this. And I'd like to welcome our panelists today. First of all, we have Waco Mayor Kyle Deaver. We have McLennan County Judge Scott Felton. We have Dr. Mike Harden from the Family Health Center. Dr. Brian Becker with the Ascension Providence, and Dr. Michael Lyson with Baylor Scott and White. Gentlemen, I appreciate you all again joining us. We're going to follow the same procedure we've done before. I'm going to let each one of you make an opening comment, and then we have several questions that we received from the media, and then we will let Judge Felton and we will open it up to the 2 people we do have on the live part of the program today. And then Judge Felton and Mr. Mayor Deaver will wrap us up on that. So let's start off with opening comments. We'll go in the order of Dr. Harden, followed by Dr. Becker, Dr. Lyson, Judge Felton, and then Mayor Deaver. So we'll start off with you, Dr. Mike Harden from the Family Health Center.
Great. Thank you, Larry, and thank you, Mayor Deaver and Judge Felton, for the opportunity again to speak with this group. I'll offer, just like we usually do, I'll offer some and review some of the local data and then offer a national perspective on that. So locally here today, we report 63 new cases. 13 of those have come as a result of the surge testing that's been in process recently. That makes a total of 10,077 cases of COVID-19. Currently, there are 531 active cases. 9,392 cases have been reported as recovered. We currently have 42 COVID-19 cases hospitalized. 28 of those are McLennan County residents. 8 of those cases are on ventilators at this time, and we are reporting 3 new deaths today as well, unfortunately. I'll also move on now and share the graphs that we usually do to put this into perspective nationally. So when we look at national new cases per 100,000 population, this normalizes the number of new cases based on the population so we can compare national to state and county to county. You can see that the United States is increased again, and as you've heard in the news, we are approaching the number of new cases per 100,000 that we were having back in the summer when we had the summer surge nationally as well. So unfortunately, that number is going up. When we look at Texas's numbers, we were much higher than the U.S. back in the summer, but we brought that number down. But unfortunately, that has begun to increase as well in the state of Texas, and the number of new cases per 100,000 are almost on par with that of the United States. And when we put in McLennan County, which is in the green, again, we were much higher than the state of Texas and the U.S. back in early summer. We dropped that number down, but never quite got below the national averages until here more recently, but we have started to increase this as well. And so we're right on par with the state of Texas. This is one of those times that it's not good to be average or on par with someone else, unfortunately. When we look at these numbers and compare where they are with metrics nationally, we know that we have been residing in this area that we call accelerated spread. We'd love to be down into the community spread level where the incidence is lower and we're obviously controlling the disease better. Unfortunately, that number is increasing at this point. And once we get over into the red zone, it is much more difficult to control the outbreak without instituting more significant measures. When we look at the test positivity rate, this is the number of tests that are, the percent of tests that are positive when we check the tests. We were high back in Texas, again in the orange, McLennan County the green. We were much higher back in the summer. We brought that number down below 10%, and it's been hovering below 10% now for at least a month and a half, almost 2 months. We're currently at 7%. Texas is higher at 9.4%, but that number recently has been increasing here. Obviously, the lower that number is, the better it is. In our local testing through the Family Health Center, we were in the 8% range as well, but over the past week have climbed to 13% in our positivity. This suggests that the positivity rate will likely probably be going up in the Waco area, McLennan County in the future. The next slide. Oh, excuse me. And there's the lines for mitigation and suppression. So obviously we would love to be below 2, 3, or 4% there. That is where Baylor is at this point in their test positivity, which is nice. But from a community, we're still in the mitigation range. Finally, the last slide I show is the effective reproduction rate, or RT. We show this weekly as well. That number is a measure of how many people one person infects when they have the disease. A number below 1 means it's a 1-to-1 ratio, or below, which is what we'd like to see. Unfortunately, in Texas, that number has crossed up recently. Over the line is at 1.15, and that's reflected also in the increasing incidence in Texas at this time. For McLennan County, we're still hovering right along at 1. We would obviously like that number to be lower as well. And that's a leading indicator of what should be happening down the road. So hopefully this means we will be behind Texas and what's happening in Texas, but we'll have to keep an eye on that as the data progresses. And that's all I have to share at this point. Thank you.
Thank you, Dr. Harden. Now let's go to Dr. Brian Becker, who is Chief Medical Officer of Ascension Providence. Dr. Becker.
Thank you, Larry. Judge, Mayor, and Mayor, thank you both for having me back again today. I appreciate the opportunity. I want to just say a few things. We are fortunate, at least in Ascension Providence, to have seen some decline in our hospitalized numbers over the last week and a half. And that's the first that I've really seen that number drop a bit in the last several months. So that was nice to see, both in our general population in the hospital as well as in our critical care patients. Both of those numbers have been showing a bit of a decline over the last 7 to 10 days. So that's I'm hopeful that that's a good sign. I would encourage folks, we're moving into holiday season, so we have Halloween coming up this weekend. We have Thanksgiving and Christmas. All of those are great opportunities to share time with family. But I encourage you to continue to think about what's smart and what's wise, and to really be cognizant of small enclosed spaces with large groups of people. I think that's something to keep a close eye on. Wearing masks, trying to avoid those if at all possible, might be a wise choice still. I think that just affords us an opportunity to look at what other ways can we celebrate these seasons with our loved ones, and what particularly makes sense for those that we care most about. Encourage folks to still wear their mask. I think that clearly that shows some benefit for all of us when we wear our mask. And so I think that's super important for us as well. And lastly, if you've not gotten your flu shot, we say it every week, but again, please be sure and get out and get vaccinated. Lots of places and lots of opportunities to get vaccinated, and I encourage everyone to do so. So again, thank you for having me.
Thank you, Dr. Becker. Now let's go to Dr. Mark Eliason with Baylor Scott & White Hillcrest. Dr. Eliason.
Good afternoon, and thank you also for having me. A few opening comments, and then be delighted to stick around and answer questions as we get going. But just a few reminders. People can still be contagious without being sick or having symptoms. And cases do have some variety in their severity. So some patients will get COVID and have no symptoms to speak of, or have a very mild case, and then some, approximately 10%, will end up in the hospital. And of those, maybe 20% or 15% may end up on life support. And so there's quite a variety. And, I've had some patients who continue to question, is this test legitimate? Do I really have COVID? I don't have very many symptoms right now. And they may be one of the lucky ones who don't have symptoms, or they may just be catching it early on and not having a progression of their disease just yet, but it may come later. So as a reminder, if you've been exposed, or if you've had contacts that are, without your mask, we ask you to self-isolate and to be safe and to not share what you may have with others. People can have a contact and will usually develop symptoms 2 or 3 days after that contact. But there have been reports of people who can be up to 14 days before they will start to develop symptoms. And during that time period, you can be contagious. So please be wise. As Halloween is coming up, as Dr. Becker said, we need to be careful. Last week, we talked about some of the recommendations from the CDC. So the CDC does have a website. And if you will just, on an internet search engine, type in CDC holiday, you'll get some great recommendations there as to some things you can do to make it as safe as possible. One specific item would be to not forego a cloth mask, but to keep a cloth or surgical mask, and not to use a plastic mask that's part of a costume. That is not a substitute for preventing coronavirus. And then one of the treatments that we have available for seriously ill patients with COVID is a transfusion of plasma from patients who have had COVID and have since recovered. That is proving very beneficial, very effective, but it requires donations from patients. So if you are a patient who has recovered from COVID, and now we have 8,000 or 9,000 of those in the county, we strongly encourage you to donate plasma. And that can be done through several organizations, but Carter Blood Bank is one that's here in the community as well. And recommend you go on their website and make an appointment to donate plasma. And that is proving to be as beneficial as just about anything we've had from the onset of this pandemic. Thank you.
Thank you, Dr. Lyson. McLennan County Judge Scott Felton. Judge Felton?
Good afternoon, everyone. I want to talk about an announcement we had last week. It has to do with economic development, but I will get how it relates to COVID-19. As many of you know and read, Amazon had an announcement of putting a facility here in McLennan County, and it by far was the worst kept secret I've ever seen in an announcement for a company coming to town. But in this, the governor wanted to be a part of it. This is a very significant announcement, and Amazon's been expanding statewide. And so the governor and myself and Representative John Kennard from the city council and others were there to be part of this announcement. But the governor's requirements were to have a COVID test prior to the event if you were going to be around him. And so those of us who were selected to be part of that group were tested. And it's very interesting. I had once before had the deep nasal, the brain tickler back a good many months ago, and didn't like it very well. But this was a very shallow test with a swab in your nasal passage, and the test was 15 minutes. And of course, it had to be because we would be within the hour around the governor, and so it was it had equipment and people there to do it, and it very smooth and went fast. And it just reminds us that there is technology out there that can improve the efficiency of how we're trying to manage this virus. And and I see federal and state government both funding more technology and to expand these things that work very well. I really think we could be very efficient on our strategic contact tracing protocols that we have after that. Quicker we find out when someone has a positive reaction, we need to be able to inform them of that so they can keep other people safe. And so I think we'll get there. I talked to the governor a little bit about it. These tests have to be manufactured and spread across the United States, and that's going to happen, but it won't happen overnight. So I asked him for a Christmas present that we get the 15-minute test here in McLennan County, that we could utilize it to get our numbers down. One other event that happened in McLennan County this past week, our district administrative judge, Ralph Strother, decided to postpone trials for a little bit longer after talking to Dr. Garner who is our McLennan County Health Authority. And his concern was the rise in the numbers, which you just heard in these reports. And so, but in all this, we've learned quite a bit too. One of the things we talked about is in rooms where meetings like this would happen, there needs to be air movement to be able to cut down on the air transmission of this virus. And so it got us to working on some of our facilities and learning how to, or knowing what the displacement of the cubic feet of air is in each of these rooms, which could help in that. So anyhow, those are happening. And when these numbers get down, we will resume trials. So thank you. I look forward to answering any questions.
Thank you, Judge Felton. Welcome, Mayor Kyle Deaver. Mayor Deaver.
Thank you, Larry. Good afternoon, everyone. Thank you for joining us again this afternoon. Let's jump right into the data. Julie, if you'll share my slides, please. We topped 10,000 cumulative cases in McLennan County yesterday. We've been on a steady rise since we slowed the exponential spread in August and September. Next slide, please. Our 7-day rolling average, which is the red line here of new cases, continues to be in the mid-60s. 63 yesterday, it was 64 this time last week. So we're not seeing much change in that, but this continues to be far too many new cases each day for a community our size. We have been seeing that now for the last several weeks, being in the 50s and 60s for new cases each day. Next slide. Baylor, however, continues to do an excellent job responding to the pandemic. Their daily new cases continue to decrease. They currently have no new cases or no active cases among their student athletes. They had that bump that you probably heard about or read about 3 weeks ago, but they are now averaging well below 10 new cases per day, which is excellent, and doing lots of testing, including participating in our surge testing. We'll talk a little bit more about that in a minute. Next slide, please. Our hospitalization rate is considerably better this week than it was 2 weeks ago. We had a couple of days then with about 60 hospitalized patients, and about 16 of those were on ventilators. We are now in the 40 to 45 patient range with less than 10 on ventilators. So let's hope that pattern continues. We've heard a lot about what's happening in El Paso, and we are near the tipping point with our new cases each day. We do not want to let our community get into the kind of shape that El Paso is currently experiencing, and our thoughts are certainly with them. Our two hospitals have so far had 1,021 cumulative hospitalized patients. They currently have 44, 828 patients have been discharged, and 149 have died in the hospital. Remember, these are not all McLennan County residents. The majority are, but our hospitals also serve patients from many other counties. Also remember that a significant number of COVID-19 deaths have occurred outside of our hospitals in our community. Next slide, Julie. And speaking of deaths, we lost 11 more McLennan County residents to COVID-19 last week. The total now stands at 154. We've had 10 or more deaths from COVID-19 in 4 of the past 5 weeks. 65 of those have been in long-term care facilities. We just must continue to be vigilant to bring our community spread down to more manageable levels. That is the only thing that will reduce these fatal cases. Thanks, Julie. Let's take the slides down now. I want to talk about a couple of things. The testing has been mentioned, but we need to continue to emphasize that. We have continued to evolve this testing to try to make it more as convenient as possible and as quick and painless as possible. Many of our sites are now offering the saliva test, and beginning next week, we will be doing exclusively saliva tests at all our sites. I'm going to ask you again, please go to covidwaco.com and register for a free test. And please encourage your friends, your family, and your coworkers and your employees to do the same thing. The Health District has leased a mobile testing van that they are calling the Aardvark, and it will be shown to the media tomorrow afternoon at 1 o'clock. It will be in McGregor on Monday and Tuesday at the Exchange Event Center at 300 Jefferson and McGregor to do testing there. And this will give us the ability to go out to large employers and do testing. So if you are responsible for HR and would be interested in having us come and conduct testing in your facility, please contact us to schedule a day to do that. That is a great way to cut down on the spread within your having a breakout within your facility, and that's a great use of these tests while we have them available to you. Another issue is that we are having our health district personnel are having some resistance when they are contacting people who have tested positive. We need you to answer those phone calls when you get a call from the health district. And you know, I know that some of you don't want to have to tell your close contacts that they may have COVID and they may have gotten it from you, but you are not doing them any favors by not telling them. It's very important that you answer any call that you get from the health district and that you contact anyone. If you test positive, you need to contact anyone that you have had a close contact with within 48 hours prior to you becoming symptomatic. I also want to encourage employers to pay your employees who tested positive, as well as employees who've been in close contact with a person who has tested positive while they isolate or quarantine. This is your best defense against having an outbreak in your place of business. And I know that many of our businesses are already doing this. Judge Belton and I were on a call with the various meat processing companies several months ago, and they had instituted that policy very early on because they recognized how important it was to keep positive infected employees out of their workplace. If you do that, if you are already doing that, please let your employees know that policy so they will know that they can be better able to comply with the isolation requirements or the quarantine requirements, depending on whether they have tested positive or been in close contact with an infected person. We've been talking about the upcoming holidays for several weeks now. Dr. Eliason mentioned it and mentioned the CDC site. That is the best thing that I have seen in terms of recommendations for alternate holiday celebrations. Halloween is this Saturday, and I urge you not to do traditional trick-or-treating. If we are not careful as a community, these upcoming holidays will cause us to have significant surge in new cases. I'd like to ask you to think about doing something new with your family this year to create a new Halloween memory or a new Thanksgiving memory. For Halloween, some of the very specific ideas for low-risk activities that are on the CDC website are things like carving or decorating pumpkins with members of your household and then displaying them, and carving or decorating pumpkins outside at a safe distance with neighbors or friends, having a virtual Halloween costume contest, or having a Halloween movie night with the people you live with. And if you can't bear to forego trick-or-treating, at a minimum, please follow the CDC's guidelines for minimizing the risk associated with trick-or-treating. And as Dr. Eliason said, remember that a plastic Halloween mask is not a substitute for a cloth mask. If your child are going to wear a Halloween mask, please wear it over a cloth mask. So I just ask you to please do your part to keep Halloween and the other upcoming holidays from causing surges of cases in our community. And finally, I just want to thank all of you who are doing everything you reasonably can to help slow the spread of the coronavirus. Many, many Central Texans are doing the right things every day and must continue. We've been dealing with this for so long now, but it is just as important now that we continue to be vigilant as it was earlier this year. So that's all I have now, Larry. I'll turn it over to you for questions. Thanks.
Okay. Now we've got 8 questions here that have been provided to us by the media early on, and then we'll take the 2 media representatives, see what they have at extra. First question I have is, since most people are abiding by the COVID protection protocols of wearing a face covering, washing hands often, and social distancing, Are the doctors noticing any decline in routine illnesses that are normally spread the same way COVID is?
Dr. Eliason, would you mind speaking to that one?
I think we are. I mean, people are still getting sick. People are still getting pneumonia. People are still getting upper respiratory infections. And flu is coming, and we've already seen some examples of that. We've already had cases for several weeks now of new cases of flu. So it is still transmitted. It is less than it would otherwise be. But people still aren't perfect with their mask wearing. I had a patient today who is in the hospital, and I asked him how he got COVID and if he knew how he got it. And he said he got it while he was out hunting deer. And he was with his brother and his brother's coworker. And his brother's coworker had it, but his brother's coworker didn't know he had it yet. He didn't become symptomatic until after their hunting expedition. And so they're out in a blind together, not wearing their mask. And unfortunate for all of them, but yes, to answer the question, we are seeing a reduction. Could it be better? Yes, it could be better. Could people be more vigilant? People could be more vigilant. And so again, wearing masks, social distancing, very important.
Okay, thank you. October has seen the most COVID deaths in the county of any month so far. Any factors that might explain that?
Dr. Becker, would you mind answering that? And I mentioned earlier, if any of you have anything you'd like to add, any of the doctors that would like to add to these answers, please feel free to jump in.
You bet, Mayor Deaver. I saw this question and trying to prepare to answer this question, I had to do a little bit of looking across our organization. And again, I can speak to what I can see internally at Ascension Providence. I'll start with a phone call to our intensivists who routinely are taking care of these patients. And their short answer was no, they didn't really see a whole lot different than the population that were taken care of in October from any of the preceding months. And so that wasn't particularly helpful to me in trying to address this question. So I looked at our data. Almost a third of the deaths that we've experienced have been in this month, in the month of October. And so that is a bit alarming to see that large of a number. And looking a little more closely, almost half of those were carryover patients from last month. So in general, a patient who gets COVID can have a short illness and go home relatively quickly. But those who get sick tend to have a long and drawn out course, particularly those in our ICU. And so a fair portion of the deaths that we saw in this month really were patients who were admitted in the month of September and had rather lengthy hospital courses. The demographics of our patients, not particularly different in this particular group. When I just look at the month of October, it ranged from 59 on up. So that was kind of the age range of the folks that we saw who ultimately succumbed to this illness. So I think that the short answer is I don't see a tremendous difference in what I look at in our patients. I don't hear of a significant difference from our intensivist. And I would be interested to hear what Dr. Eliason, who takes care of these patients routinely, sees, if he has noticed something different.
Yeah, I would have the exact same comments, and I may say it just a little bit differently, but as you said, we had slightly fewer deaths in September. When patients become critically ill and eventually succumb to the illness, it's not a 3-day adventure. It is long and drawn out. And they may be sick for several days to a week, and may sometimes even 2 weeks before they'll show up to the hospital. They're sick in the hospital for a few days, and then they may get more sick, and then they'll move to the ICU. They may get intubated that day or a few days later, and then they're often on the ventilator for days to weeks. And so their hospitalization can sometimes be a month of just a difficult time for them. And so, what I say is when people die, it's after a long time. Again, here at Hillcrest, as well as it sounds like at Providence, we're not seeing any different demographics. We're not seeing any different disease course. the treatment methodologies and protocols that we have are the same. I think it's just a clustering of data. What I have noticed in my personal practice here in the last couple of weeks is we've had a lot of patients come in and over the last 2 weeks have not had serious progression of their disease, which is delightful. So we've had quite a few people going home with a short hospitalization. But in the last few days, we've had a few patients who have progressed and who've gotten very sick. So we had a period where there wasn't a whole lot of sick patients progressing, and now we're having a few that are. And so this is perhaps just kind of an anomaly with the data. It's not that the disease is changing. It's not that we're having more patients getting infected. I know it's kind of a maelstrom of comments there, but just the short answer is nothing's really changed.
Okay, difficult situation, I know. McLennan County has had more deaths than other counties, some of which had COVID cases, higher populations, more. Like Bell County, I think, was a given example in this particular question. Any reasons why?
Dr. Harden, can you try to address that, please?
Sure, I think that's a great question, especially in context with the last question as well. So when we look at numbers like that, it's important to look at more than just that number. There would be two numbers I'd look at to make sense of that difference there. The first one is if we do compare the actual number of deaths by 100,000 population and compare that with Bell County, McLennan County nearly has double the death rate compared to Bell County. If we look at Travis County, we're about a third higher than Travis County, and we're about equal to Dallas County. If you actually want to drill down into these numbers, you can look at the UT School of Public Health website out of Houston, their COVID website, and there's different tabs you can go on to look at these rates and compare counties. But if we drill down a little further and we look at the actual number of COVID cases per 100,000 population, we see that we have those exact same proportions. So we've had almost double the number of cases per 100,000 that Bell County has, a third higher than Travis County, about equal to Dallas. So what we like to refer to is something called the case fatality ratio, or that's the number of deaths per confirmed COVID-19 case. And if we look at those between the counties that I just mentioned, our ratio is all about the same. So that means that our death rate per case is equal. So the reason that we have more deaths here in McLennan County than Bell County or some other places is that we've had more cases per 100,000 compared to them, but our death rate due to the infection is exactly the same. If you compare this ratio, this case fatality ratio of McLennan County or Texas to the national average, we're actually lower than the US average at this time. And while we're on the topic of case fatality ratio, I will point out that you'll hear people say, oh, it's just like the flu or this infection is no worse than the flu. But based on our best data right now, when we can compare the case fatality ratio for COVID-19 to the ratio with influenza, it's at least 10 times deadlier than influenza. So this is a very deadly disease. It's not like the flu. Our death rate is very similar to other counties when you compare this ratio.
Okay. Colder weather arrived this week, and activities now outdoors will start to be moving inside. Any different COVID spread mitigation advice as people will now be doing more things inside?
Dr. Becker, would you mind speaking to that?
Yeah. So it is Texas. If we wait a minute, the weather will change and we can go back outside again. We're heading into fall and winter, and the weather will be different, and I think that it'll be more difficult for folks to enjoy outdoor. It's been if you look for silver linings in this, the fact that people have gotten out, started exercising more, enjoying the outdoors, that's a silver lining that we can find. Moving into the months where it might be weather that's not so conducive to outdoor activity, I think we have to keep those same things in mind. The short answer is no, there's not anything new. The same things that we've been saying now for months still apply. So large indoor gatherings should be avoided. Wear your mask inside. And so I think those things still apply. We want to be cognizant of where we are. So I think theaters and churches have been trying to figure out how to navigate this now for some time. Be aware, be conscious, do still on days that look nice, get out and enjoy a walk, enjoy the park, If it's a nasty day, stay inside, work a puzzle, watch a movie, try to avoid big crowds.
Okay, looking forward to Christmas celebrations and spring activities, what things need to change before restrictions on large gatherings will be relaxed?
Judge Felton, would you speak to that? And I have a couple of things I'd like to.
Sure. Well, first of all, to the fine doctors, the mayor, Larry, and his staff, I'd like to be the first to say Merry Christmas. As we've mentioned before on questions like this, that the governor's in control and he has certain things that he's looking at. I'm sure not unlike what we're looking at here as well. I think there's going to have to be a downward trend and not an upward trend, especially with what's going on in El Paso and the deep southern valley of Texas. Those will have to change before he relaxes anything that's out there right now, in my opinion. But I don't know that for sure. But back when you, Mayor, when you were talking about Halloween and how people celebrated or participate in it, it's the same thing for Christmas and these other holidays, Thanksgiving coming up, and it's planning on how you're going to enjoy it and to still ensure the safety of your friends and family. So keep that in mind as well. So, Mayor, you can correct or apologize for anything I just said.
No, thanks, Judge. I agree with what you just said. Clearly, the governor has taken control over the mandates. And what I would just ask people to do is not focus on the mandates, but focus on what's smart. And that goes right back to those CDC suggestions and guidelines. Really encourage you to do those things and not put your families at risk. You love these people, you care about these people. I know it's hard not to do celebrations the way we've always done them, but this is not a permanent thing. Hopefully by this time next year, we'll be back to enjoying Halloween and Thanksgiving and Christmas in very similar ways to the way we have done in the past, but this is not the year for that. And so I just urge you to be smart and remember that you're protecting the people that you care about and that you love, and just don't worry about the mandates. Take care of yourself and take care of each other. Thanks.
Okay, we've had this question come up at other press conferences, but it still seems to be a very topical subject. Flu season is rapidly approaching. Why is it so important for everyone to get their flu shot this year?
Dr. Eliason, would you speak to that, please?
Sure. Yeah, so flu is a respiratory infection, and it makes it hard to breathe, or can, in some people, particularly those with chronic respiratory diseases like emphysema, COPD, asthma, chronic bronchitis. So it has symptoms similar to COVID. As mentioned by Dr. Harden, its impact on mortality is not anything like COVID, but there can still be and will be deaths from flu. Like COVID, it is a preventable disease. One of the ways to reduce risk of transmission and risk of death is to get a flu vaccine. Secondarily, it's to wash hands and avoid touching your face, touching your eyes, and wearing a mask. So similar to COVID. Now, why is it important to get a flu vaccine? Well, if you get flu, there's always this question in your mind, okay, do I have the flu or do I have COVID? And then what do I do with that information? Do I need to isolate, or do I need to, can I go back to work when I'm feeling better? Do I need to isolate for 14 days? Those types of things. But the real meat of the question is, the risk is if you have flu and you have COVID at the same time, I don't know if it's a direct proportional two-time doubling risk of injury to your body and death or not. But the point is you're going to be more susceptible to a more serious outcome. And again, the emphasis is this is preventable.
Okay, kind of on that same subject, do we expect to see a bad flu season on top of COVID-19, or are the measures we're taking related to COVID-19 expected to slow the spread of the flu?
Dr. Harden, would you speak to that, please?
Yes, We actually don't know at this point. What we do know is that the flu season usually occurs in the southern hemisphere first before it comes to the northern hemisphere, and it was milder this year in the southern hemisphere. We think that's due to the fact that there was a lot of social distancing, there were a lot of mask requirements, and we believe that made the flu season much milder. The strains of the flu that are predicted to occur in flu season this year in the United States are similar to those that have been in prior flu seasons as well and prior flu shots. The more flu shots you've had in the past, actually, the better you do in terms of resisting the flu and the complications of the flu. So right now, we hope this means that we're going to have a lower incidence of influenza this year. You know, another reason, as Dr. Lyson said, so important to get your flu shot. Even in years where we just have influenza and we don't have COVID-19, we fill the hospital with patients due to complications of the flu, and the ICU as well can get very busy and close to being overwhelmed. We add that on to COVID-19 as well, and it may significantly strain the resources that the hospital have. So getting your flu shot is very important. The flu shot doesn't guarantee you won't get the flu, but the flu shot does help prevent the complications and prevent deaths from the flu, and that's why it's so important this year.
Okay, our final question is, we actually received this question this morning from a viewer, and I think the subject is focused around the vaccine that's being talked about for the COVID-19. I'm going to paraphrase. Is the COVID-19 shots made from live or dead virus? I don't trust the safety of these shots because there is a political pressure from the vaccines to be ready before the usual process for safety and side effects from the FDA. A lot of people feel the same uncertainty. What can you or one of the doctors say to alleviate people's distrust?
Dr. Harden, would you take that? And then Dr. Becker or Dr. Alassen, if you have anything to add, please feel free.
Sure. I guess the first thing I could say is once we have an approved vaccine that's been through the process, if I'm one of the ones who's deemed eligible to get that vaccine, I will be in line getting that vaccine. I do trust the process. I think the best way to educate yourself about this is to read about it. And a great resource online is the New York Times Vaccine Tracker. If you look at that, it outlines all the vaccines, over 100 that are currently being developed, where they are in their testing stages, and it reviews the overall approval process. Right now, there are 11 that are in phase 3. So phase 2, they've been tested for safety and effect. And then phase 3 is really where it's given to a larger number of people to look and see not only is it safe, but does it actually work? Does it keep you from getting COVID-19? All those types that are in there do not involve live virus. So there are no live virus vaccines that are being used that are live coronavirus vaccines. There are actually 4 that are in that phase right there of different types. And you can read more about them, but one of them is a dead or inactivated type of virus, which is a very typical vaccine that we've done in the past. Another one is where they take little pieces or proteins from the coronavirus and put them onto a very microscopic particle and inject those so your body will make antibodies against that protein. Another one is where we take the adenovirus, which is a cold virus, which is a typically harmless cold virus, but we change it to where it expresses some of those COVID or coronavirus proteins on its surface, so you make antibodies against coronavirus. And then the last one is where we actually take a special type of RNA or genetic material called messenger RNA and inject that, and it has your own body make those proteins, so your body will make antibodies against that. And so those are the vaccines that are in trial right now. What is unprecedented right now, besides the speed, is not bypassing safety processes, but is that there's been so much money put behind this effort. We have so many vaccine candidates out there, and that the companies who are making them are actually making the vaccine now and producing it in case it is safe and is approved, so we can get those doses out to the public. Otherwise, normally once a vaccine is approved, it takes a long time to produce that vaccine and distribute it. So what really is happening, and where the speed has really occurred in this process, has been the production of these vaccines. If that vaccine is proven not to be safe or not to be effective, they will just discard all of those vaccines and not use them. But that's at the expense of the federal government, who's put in the money to support that. So the short answer to that question is that, yes, I trust that safety process. I trust those who are doing those investigations. When it's approved, I'll be in line to get my vaccine if they let me get one.
Okay.
Yeah, I would say the same thing. I have no hesitation to get in line once it's deemed effective and safe. And as Dr. Harden eloquently stated, safety measures are still in place. They are still testing and verifying, again, safety and efficacy or effectiveness. And one of the ways that this has been sped up is they are overlapping some of those stages of trial. So as a stage 2 trial is underway, and maybe halfway through or thereabouts, they'll start a stage 3 with a new patient population. And so they get in far enough that they show that it's not harmful. And so then they're going to take on to the next stage. And then as he also said, that the production is ramping up so that when it's approved, it can be quickly distributed to the patient or to our population.
And I'll follow on the heels of that and simply say, to make this unanimous, so that you clearly understand, all 3 physicians on this panel say that they would stand in line to get this shot. I don't have any particular concerns that they are shortcuts, that they are bypassing safety measures. It's not going to make it to our level of receiving a vaccine unless it's proven to be safe. And so I too would stand in a line to get that vaccine. So I suspect out of the 3 of us, Dr. Eliason's probably going to be closer to the front of that line than I will be. But certainly feel that it's important to clearly understand that all 3 physicians on this panel would stand there to get that vaccine.
And I'll say one more comment too. When we had the H1N1 pandemic back in 2009, there was urgency to get the vaccine out following that pandemic. And I remember hearing a lot of similar comments from people, and it's okay to be weary. It's okay to be nervous and to ask questions. And so when you have those questions, go read. But I remember in the 2009 pandemic, when the vaccine did become available, there were a lot of people in the healthcare community and not healthcare community who had concerns about the safety of that vaccine. I did not. And I know of no one who got that vaccine who had problems from it. And we saw a dramatic reduction in H1N1 cases following that vaccine.
Okay. That completes our questions that were received through the media previously. Now we have on the line, we have 2 representatives. We have Drake Lawson from KWTX News Channel 10, and we have Mike Copeland from the Waco Tribune Herald. And I will call on each one of them. They can ask a question, and we'll have 2 rounds. So each one will have 2 questions. So let's go now to Drake Lawson with KWTX. Drake, are you on the line?
Yeah, Larry, can you hear me okay?
Sure do. Go ahead. Ask your question.
Okay, perfect. I know Dr. Farley-Verner's not on the call, but mentioning earlier on in this press conference, Judge Felton, you talked about his decision to put a stop or put a halt to jury trials. Was the reasoning simply because of the increase in cases? Because I know you guys came up with a plan. You know, there was supposed to be a lot of PPE protocols, whatnot, incorporating Zoom. Was there an issue with the plan, or was it just because there's been an increase here lately?
Well, no matter how well you plan and put these protocols together, that does not mean that you totally eliminate the risk in anything that we do. And so just the fact that there was an uptick, we're not seeing a downtrend that would be a better situation to start one more thing new was that. And I mentioned the air circulation, but that was that was just something we learned and part of the information that was requested. But no, it was primarily, I think our protocols will be as good as anybody could put together, but it was just the fact that you can't do it without some risk. And so while this uptick in trend is prevalent here right now, well, then we just wait a little longer. You know, maybe just a few weeks longer.
And Drake, I want to be clear that it was not Dr. Verner who made the decision not to hold trials or not to start them immediately. It was his advice not to. It was Judge Strother's decision. He is the person that is authorized to make that decision, not Dr. Verner.
Thank you, Mayor. That's a good point.
Thanks.
Okay, Mike Copeland was signed up to be on the call, but he's not here. So Mike's not being seen on the registration. So I guess, Drake, you're the only one. You have another question for us.
Yeah, I had one other one. Thanks for that clarification. First of all, Mayor Deaver, I appreciate that. Always want to make sure we're crystal clear. My other question was involving an email that was attached to Bell County. Now, I know this is different and they have different situations, but When they sent out their numbers yesterday, they talked about that their trends may be a little off because a lot of people are opting for rapid and antigen testing. And they said the downside with those tests is that they're not confirmed COVID-19 cases. So they don't appear on the confirmed count. I see Dr. Harden shaking his head. So is this the same here for McLennan County? Do those not get incorporated? What does that mean when you talk about rapid and antigen testing maybe messing up our numbers?
Well, I'll ask Dr. Harden to talk just a little bit about the efficacy of the antigen tests as compared to the PCR tests, and then we can talk a little bit about the reporting issues as well.
Yeah, I'll try to keep it simple. When a COVID-19 test is positive, so it doesn't matter if it's a PCR test or an antigen test, whether it's rapid or whether it takes a few days, if it's positive, it's positive. And that doesn't mean that you're actually sick with COVID-19 at that moment. It may mean that you had COVID-19 and you got over it and there's just a little virus left in there. It means that you could have COVID-19 and have zero symptoms, or it means that you just had COVID a week or two before and have some dead virus particles that are still in there. Those tests are so sensitive that they will pick that up. But if a test is positive, it's positive. So I'm not exact. There are not what we call, at least in the antigen tests that we use at our clinic, they're not false positives from that test. If it's positive, it is positive. Now, some tests, any test can miss the presence of that disease, and so can have false negative tests. But in terms of it being as positive, it's positive. Those antigen tests don't have to be backed up or checked with another test to see if they're positive or not. The PCR test, which was the first genetic test that came out, is super, super sensitive. If you have a few particles of that virus in the specimen, it will pick it up. The antigen test is not as sensitive as that, but some experts nationally feel that that's actually a better test because it avoids picking up some of these cases that really aren't true cases of COVID-19. The best test that we have is something that's fast and accurate, and the antigen tests and some of the new tests that are coming out are that test. They only take 15 minutes to get the results back instead of waiting hours or days for a PCR. So although I don't know the context of what was in that statement or what was out there, antigen tests do not confuse the positive test results.
And what I understand, Dr. Harden, and correct me if I'm wrong, is that there may be a slightly higher risk of a false negative with an antigen test. But as you said, if it's a positive test, you can be sure that you have the disease.
That's right. And every antigen test is different. And so the problem with all these tests, you have to remember, this is a brand new disease. This wasn't present until 9 months ago. And we have invented a whole host of tests. And every one of these tests that we're using is not truly FDA approved or evaluated for its accuracy. We can only base it on what we can do at this point, but it hasn't been around long enough to have all of those studies. So the best evidence we have, depending on the test, is that a PCR test is very, very sensitive for finding it. An antigen test, depending on the test you're using, is anywhere about 90 to 95% sensitive. When it first came out, we were told 80%, but we just got new data on the tests that we're using that shows it's about 95% sensitive, which is really very highly sensitive. So we don't know for certain the sensitivity. We'll know more on that as time goes on. But you're right, the antigen test tends to be a little less sensitive than the PCR test.
And Drake, I think the issue has come about because the state several weeks ago started classifying antigen tests as probable cases rather than confirmed cases. But I have yet to hear an explanation for why the state has taken that position, and the healthcare experts that I've talked to don't understand it. So I think when they're saying their numbers may not be exactly right, they're saying that there are, in addition to the confirmed cases that were tested with PCR tests, they also have positive antigen tests that, because of the way the state is requiring them to be reported, don't count as confirmed cases. Here in McLennan County, I believe that Kelly, you can correct me if I'm wrong, Kelly Crane from the Health District, I think we are counting both positive PCR tests and positive antigen tests as positive tests in our numbers. Is that correct?
Yes, sir,
Kelly?
that is correct.
Okay, thank you. sure we're not giving bad information. So, all right. Any other thoughts on this from any of you? Okay, thank you.
Drake, since you're the only one on, do you have one more question?
No, that pretty much answers it. Thank you, Larry, and thank you, Mayor Deaver and Dr. Harden. I appreciate that thorough explanation.
Well, thank you for being on the line and giving some good questions. Well, let's go to our wrap-up session, and what we'll do here, we'll ask for Judge Felton to speak first, followed to our Mayor, Kyle Deaver. Judge Felton?
Thank you. Thanks, folks, for joining us, and really want to thank Dr. Harden, Eliason, and Becker for being on, giving great answers to these questions that come up each week, and for Mayor Deaver for hosting it, and not to leave out Larry and his team at helping us put this program together. One comment that was made earlier was about the plasma donations, and if I'd tell the medical community, if we see we need a lot more participation in that, well, we think the mayor and I would help try to promote that to get more people to help out in the community by donating their plasma. Other than that, I don't have anything else, and enjoyed being with y'all. Mayor?
Okay. Thank you, Judge. And I also want to thank Larry and Julie and Kelly and their respective departments at the Municipal Information Office, the Health District, and the City Secretary's Office, and all of those that make this possible each week. It does take more behind the scenes than you would imagine, and especially with the technology that we're dealing with. Really appreciate all the work that you've done and continue to do each week. Judge Felton, thank you for being here again, as always, and giving your wisdom. And Dr. Becker and Dr. Eliason, glad to have you back as always. And Dr. Harden, welcome back. Glad to have you on today. You guys are such great representatives of our health team here in Central Texas, and you really appreciate you taking the time to answer people's questions, because people are still concerned, they're still worried, and it's just great to be able to hear from you all with expert information. I also want to thank the staff of our Emergency Operations Center and our Health District who have been coordinating the surge testing, as well as everyone else who's been working on this important testing. It is a huge project, and we've got partners, community partners across Waco and McLennan County that are pulling together to make this happen, including those who've made their facilities available as testing sites. I wanted to acknowledge again that COVID fatigue is a real thing. I know you're tired of this. I'm tired of this. Judge Felton is tired of this. We're not nearly as tired of this as our healthcare workers and our first responders. So if you're feeling stress, if you're feeling like you may be getting to approaching a breaking point, please reach out to a mental health provider. And if you don't have one, go to covidwaco.com and you'll see the link for coping with stress. That will take you to Texans Recovering Together, which is a free, anonymous, short-time crisis counseling service that's being provided by the Texas Department of Health and Human Services. We also have free counseling available through the Heart of Texas region MHMR. There's plenty of service out there to help you deal with these things, and there should be no stigma about asking for help. These mental health issues are real, and you can't always just work them out yourself. So don't be afraid to make that call. It is there for you, and we have people that are waiting to help you with that. I ask that you please continue to keep the victims of COVID-19 and their families in prayers, as well as our healthcare workers and first responders. As I said, if you think you're tired of dealing with this pandemic, just think about how worn out they all are. And they continue to put themselves out there at personal risk to take care of us. Please continue to take care of yourself, take care of one another. We're in this together, and we're getting through this together. Thank you.
Well, thank you all again for providing great information to our community. And I want to encourage everybody to realize that at 4:30 this afternoon, our Hispanic population will be able to see everything and hear everything that was said today. And at 7 o'clock tonight on our channel at Waco City Cable Channel 10, you'll be able to see a complete replay of this. And it's also available on demand anytime from like 4 o'clock this afternoon. It'll be on the covidwaco.com website. Just click on the Community Resources section, and there you'll see the latest press conference that we just talked about. Don't forget to get your flu shot, I think, is another thing that we want to remind everybody of. And we will be back here again next Wednesday at 1:30 visiting with these experts and people who are totally interested in the safety and well-being of our community. Thanks for joining us. We'll see you next time.